Q. Which of the following data collection methods does not involve a group? A. Focus group discussion. B. Group interview. C. Panel discussion. D. In-depth interview. Right answer, D. Q. According to guidelines, the fasting blood glucose, FB's, cutoff value for diagnosis of diabetes mellitus is A. 126 milligrams per deciliter, B. 110 milligrams per deciliter, C. 100 milligrams per deciliter, D. 200 milligrams per deciliter. Right answer, A. A patient in the ICU is undergoing continuous bladder irrigation following TURP. During the procedure, the outflow suddenly stops. What should be the nurse's next appropriate action? Notify the doctor immediately. B. Check the catheter tubing for kinking and monitor intake output. C. Increase the flow rate of irrigation. D. Irrigate the catheter gently with sterile normal saline to relieve blow. Right answer, B. Q.4. During hemodialysis, a patient suddenly develops dizziness, hypotension, BP 80 over 54 millimeter of mercury, tachycardia, HR 120/min, and altered level of consciousness. What is the priority nursing action in this situation? A. Continue dialysis as prescribed. B. Stop or slow dialysis and place the patient supine with legs elevated. C. Consider it a normal condition. D. Start 0.9% normal saline bolus. Right answer. Q.5. A patient is scheduled to receive intravenous chemotherapy. Before starting the infusion, the nurse must ensure proper assessment and preparation to prevent complications such as infiltration or adverse reactions. Which of the following is not an appropriate nursing assessment before initiating chemotherapy? A. Assess for minor and major adverse effects. B. Monitor vital signs for 10 minutes. C. Right answer, B. Q.6. A patient on continuous non-invasive ventilation, NIV, support is still showing signs of hypoxia despite optimal settings. The nurse is monitoring the client closely. What should be the next most appropriate step in management? A. Wait and watch till spontaneous improvement. B. Discontinue NIV and place on face mask. C. Intubate the patient. D. Continue NIV for a few more hours. Right answer, C. Q.7. Patient in the hospital setting experiences an unexpected incident. Which of the following situations would be classified as a sentinel event that must be reported immediately? A. Minor pressure and redness on the skin. B. Patient sustains a major injury or fracture after a fall. C. Minor delay in medication administration. D. Delay in receiving laboratory reports. Right answer, B. Q.8. During labor, a fetus is descending but is unable to engage at the pelvic inlet. The obstetrician explains that there is a specific anatomical space at the pelvic brim where the head is arrested. What is the name of this space? A. Dead space of pelvic inlet. B. Dead space of Morris. C. Dead space of pelvis outlet. The waist space of Morris. Right answer, D. Q.9. A woman in labor is undergoing active management of the third stage of labor, and so. The uterus is boggy, and the nursing officer is performing controlled cord traction to deliver the placenta. Which of the following maneuvers should be performed simultaneously to prevent uterine inversion? A. Apply fundal pressure. B. Vigorously massage the uterus. C. Apply counter pressure over the pubic side. Right answer, C. Q.1. A nurse assisted with the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? A. Warming the crib pad. B. Closing the doors to the room. C. Drying the infant with a warm blanket. D. Turning on the overhead radiant warmer. Right answer, C.